Canadian health officials are sounding an alarm over an outbreak of salmonella, an extensively drug-resistant type of salmonella, which makes treatment more complicated. There have been dozens of cases confirmed across 6 provinces, and Hilary Johnstone has been looking into this for us. She's in Ottawa this morning. This is something that's been going on for almost 3 years now, Hilary, a little bit under the radar. So tell us more about this outbreak.
That's right, Heather. So there were a number of cases recently that public health officials started looking at. They started noticing that there were more cases, like we're saying, across a number of provinces here, 6 in total. They then went back and looked at some cases from 2020, and they realized after some genome sequencing that they were connected, that these were cases with something in common with some of those earlier cases from a couple of years ago. 40 cases now in total, although health officials do believe that there are likely more of them out there, 6 provinces in total. In terms of what they have in common, people who did develop salmonella, in some cases had been exposed to raw pet food, or dogs who ate raw pet food, or cattle as well, in particular calves. So those are sort of the common links here. They have not discovered if there's a common dog food supplier that might be sort of linked to all of this. But in terms of what you were speaking about there a moment ago, the fact that it's extremely drug resistant, that of course is going to cause some challenges. And for more on this, we spoke with Dr. Isaac Bogosh.
You hear XDR, it means that it is extensively drug resistant, so there's far fewer treatment options for antibiotic tablets, and there are still options available for intravenous antibiotics, but not as many as one would like. There's still antibiotics, but fewer of them, and you'd have to carefully select an antibiotic to treat the patient.
So you now have officials from the Public Health Agency of Canada, Health Canada, the Canadian Food Inspection Agency, and various provincial public health units working together to try and figure out exactly what it is that has happened here. 43% of the cases were in children under the age of 5. So still a lot more questions, of course, Heather, from some of those public health officials now looking at all of this.
So people can obviously contract salmonella, Hilary, and can spread it. It is transmissible in a number of ways. So what should people watch for, and what should they do if they think they've come into contact with someone who has salmonella infection?
And as we heard from Dr. Bogosh, you can even potentially get it from your pet who might have it as well. So Dr. Bogosh said, first things first, good hand hygiene, something that we've been hearing about for different reasons over the past couple of years, but still really, really important to keep in mind. And if you do have symptoms, and you can see those symptoms there on the left-hand side of your screen, it often presents in most people as some sort of gastrointestinal illness. Some people need to be hospitalized. In this case, there's been 13 hospitalizations. There have been no human deaths so far. But a lot of people can get over this on their own. So what Dr. Bogosh said is, if you think that you have symptoms, if you think that possibly you've been in contact with some of these things that we've been speaking about, to talk to a doctor. A blood test can be done, a stool test can be done as well. And even though this is extremely drug resistant, there are still options. There's just fewer of them, not as many drugs available to people who might have one of these more drug resistant options, or strains, I should say, of salmonella, but there are still treatment options. So don't panic. Seek medical attention, of course, if that's necessary.
More information up on the Government Canada website, I noticed this morning as well, Hilary.
That's right.
Thank you very much for all of that.